Hi everyone, welcome to Carrington College. I'm Miss Medina, I'm the dental instructor here, and today we are going to be performing alginate impressions on the maxillary and mandibular arch. So what alginate material is, it is a powder form that looks like this, and most alginate impressions have a scoop for measuring. You can also see alginate impressions that have a type of whiteless powder, but we can also see that there's a scoop in there as well. With each alginate impression material with their scoop comes a measuring cup. Since these are two different materials, they have two different measuring cups. Now, if we were to go and do 2 scoops of alginate here, we would need 2 measurements of water. Now, if we were going to have a patient who has a wider mouth and we need somewhat like a large tray, we're going to want to use 2 or 3 scoops of alginate. If we have a child or maybe someone with a very small mouth who needs a small tray, we can use 1 scoop of alginate. The temperature of water makes a very big difference when you're mixing alginate impressions. The water, if it is hot, like it affects, temperature affects a lot of things in dentistry. If the water is hot and we start mixing this alginate, the alginate impression material is going to set faster, okay? Which means that we have to speed it up. So every time you mix an alginate impression, you want it to be cold water. So now that we have our mixing bowl, we have our alginate impressions, and we have our cup filled with our cool water, we are going to get the measurements ready for our alginate impression. Now, this little guy right here is a mixing spatula. Mixing spatulas can be plastic. They can even be metal. And this particular guy is plastic and it smells like orange for the sake of the patient. So what we're going to do is when we measure our alginate, we want to be sure that we scoop the alginate and we go ahead and we pack it down with our spatula like so, okay? And we kind of even out the scoop. Because if we're measuring 2 scoops of water and we have a heaping scoop, then the alginate is going to set faster because there's not enough water. Then you take your scoop and you tap the top of the scoop to get the impression material into the bowl. Again, scoop, pack, and measure. And then, so the next thing we are going to do is we're going to mix this and set the tray. Now, when you do alginate impressions, like everything in dentistry, you want to be fast and efficient because we have our patient in the chair waiting, we have a schedule. And so this particular alginate impression, there is a fast set, which is this one, and there is a regular set, which is this one. Now, when the time you put the water in to the time it sets, you have anywhere between 2 to 3 minutes. And so once you place this water in the alginate, you have to mix pretty quickly before it starts to set. Now there's a 30-second mixing time, and then there's about a 1-minute time to load the tray, and then an additional 1 to 2 minutes to set in the patient's mouth. What we're going to do is we are going to go ahead and start with our water and pour it in our mixing bowl. So we go ahead and pour like so. Right. The first thing you want to do is you want to mix the alginate impression material with the water. Because if you start mixing like crazy, all the powder is going to pop out everywhere. So you want to go ahead and get everything wet. So now you guys can see all that clumpiness inside, right? Okay. So the next thing you want to do is you want to press this material against the side of the bowl so all the bubbles and all the material can mix together. And again, this is a skill that we will be able to practice. Now, if you guys notice, the powder turned pink, then it turned purple, and now it's turning light pink again. So this particular powder starts to turn white when it's setting, okay? So as you can see how the consistency now is a lot more smoother, okay? So again, I'm going and using the side of my bowl and turning to push down and mix this material. And again, these are why the bowls are the rubber the way that they are. So we're going and we're mixing here. Once you feel like the mix is mixed all the way, there's no clumps, there's no dry powder, you can then scoop it into the alginate tray. So what you want to do is you want to take a huge scoop of alginate material, take your tray, and you want to go ahead and use the side of the tray to help push the material in the tray, and then use a spatula to help spread it around. You want to go ahead and grab the next amount of alginate impression material and do it on the opposite side. All right, so once you have the material placed into the tray, Sometimes it's good to use your finger to help smooth out, because if it's all clumpy in here, when you take your impression, it's going to distort the impression. So when you guys are placing the alginate impression inside the tray, it is very important that you guys have this nice consistency. I don't want a bunch of clumpiness, a bunch of dryness, and you can kind of see the difference of the two. How this one is really, really smooth, and this one's kind of clumpy and dry. So if you can think about it, if we don't have a smooth consistency and we go ahead and we place this in our patient's mouth, it's not going to correctly capture all the anatomy and the shape of the patient's tooth. All right, so now we're going to do our alginate impression on our patient. This is going to be an alginate impression demoing the maxillary arch. So we're going to do type of simulation, and we have Heaven, our student, volunteering today. The first thing you want to do is you want to put a patient bib on them. We are doing an alginate impression in the mouth. Sometimes patients may drool, and sometimes patients will have a gag reflex. So we want to be sure that if anything happens, they're protected. So we are going to go ahead and place our PPE on, our mask, and our gloves. When taking an impression, what we want to do most importantly is we want to adjust our patient to the height of us. We want to go ahead and lift the patient up in the chair. When I'm placing an impression in my patient's mouth, we should be comfortably like this, kind of where our forearms are parallel to the floor. So I'm going to go ahead and have Heaven open up. Okay. So the first thing I'm going to do is I think she may be a medium. So I'm going to go ahead and grab my medium tray, and I'm going to place it in the patient's mouth. So when we place it in the patient's mouth, what we're looking for is comfort. Is it going to pinch their cheeks, pinch their gums, rub against their teeth? Does it even fit in the arch to be able to capture the whole entire mouth? Please open. I'm going to use my finger to retract her cheek, and I'm going to swoop in the tray like so. Open big. And then I'm going to lift her lip and try this tray on. Now, open please. I feel that this tray can't go all the way inside her mouth because of the fact that her arch is too big. So if here's our tray, the patient's arch is kind of like this, and the tray is not going down all the way. So that lets me know that I need to go ahead and try on a different tray. So I'm going to go ahead and go with my large. So again, we're going to do the same thing. Open big, retract the cheek with my finger, and go ahead and swoop in the tray. Stay open for me, don't bite, and then I'm going to retract the lip and press the tray down. So then now we have the impression tray ready for our patient. So now that we located the type of tray that we're doing, we are going to start mixing and then place the tray. For demonstration purposes, we had pulled the cart up closer to the patient, so you guys will be able to see me mixing and going through the procedure. Usually in an office, everything is done behind the patient. So the patient doesn't see the trying of the trays, doesn't see the whole setup here. Okay, Heaven, thank you for coming into the office today. The doctor requested we take some alginate impressions. So you take your scoops of alginate, use your spatula, and today we are going to use 3 scoops because I'm using a large tray on our patient. Again, measure the scoops, pat them down, compress them with the spatula, even them out, and then place them in the bowl. Every operatory has water, so you should be able to fill up your measuring cup with water. We use 3 scoops, so I want to go ahead and use 3 scoops of water. Place the water into the material, and you go ahead and mix. When mixing, you want to make sure all the material is wet before you start using the sides of the bowl to press out all the air bubbles. Again, now that everything is mixed, we are going and making this material a smooth consistency. Okay, we'll take 1 scoop, use the side of the tray, place it in. Again, you can use your finger or the spatula to help make sure that alginate impression material is smooth in the tray. Okay, go ahead and open. Retract with the finger, hold your tray like so. Right. Line up the midlines, retract the lip. At this particular point in time, it should take anywhere from 1 to 2 minutes for this alginate impression material to set. And so see my position, this hand over here has alginate material, so it's away from the patient's head and I'm using my forearm for support. So it feels like the material has dried, has set. So I'm going to go ahead, place that air bubble, rock back and forth, and then we have our impression like so. So now we're going to move on to the lower jaw, which is our mandible impression. The goal of trying in the tray is you want to make sure that the tray seats all the way down and you have a little bit of wiggle room so it's not tight against the teeth where you can miss that on the impression. And so again, open please. We retract, slide in, bring our tray, retract the lip, line up the midlines, and press the tray down. Then we're going to go ahead and support the jaw with our hand like so. Okay? Now we will have alginate material on our fingertips, but not necessarily on our palm. And we can use our thumb to press the material and see if it is set. So now our alginate material has set and now we want to remove the tray. I'm going to go ahead and switch fingers and hold this tray with my hand. I'm right-handed. You probably want to use the hand that you're most dominant with, right-handed, left-handed. And so I go ahead and switch positions. I hold the tray like this, take my index finger, go into the mouth, under that vestibule, and at the same time, make an air bubble, and then wiggle that tray up and then outside the mouth. So now we are going to try the impression with the material inside the tray for placement and removal. We have our smooth consistency like so. All right, Evan, please open for me. Retract the cheek, swoop in the impression material, track the lip, find the midline, place the tray, support the jaw. I can use my thumb on the side here to just check that impression material to see if it's set. This particular material sets pretty fast, so we're going to go ahead and remove it. I'm right-handed. I'm going to grab the tray like so, index finger, round the vestibule, find that air bubble, rock, and remove like so, and we have our impression. After impressions are done, patients usually get really messy from the alginate. And so what you would do, and recommended, is to go ahead and change your gloves and grab a fresh pair of gloves. And on our tray, we have a piece of gauze. You can wet the gauze, and you can go ahead and give your patient a courtesy clean. Sometimes you don't have to do this, and you can just escort your patient to the bathroom.